Yes.
Oh. Oh my God.
Big breath in and close.
Oh my God.
You're getting some good air now.
Yeah. Wow.
So I have Freddie here. I'm glad you came. Like, how'd you learn about the channel or, you know?
Looking through Instagram, friends saw a post of Sean Avery's, who's a friend of his, and
Yeah.
that kind of turned me on to it. Started
Okay.
following you, and then over the last couple months, a post came up and was really interested. And finally, I hit message one day, and instantly reply came and called the office or text the office, and I got a real quick reply and
Super
was
cool.
really pleased I could set up an appointment rather swiftly.
And you have a few things that you were thinking. You thought maybe you'd do the CFR
Yes.
because you snore sometimes?
Snore definitely. Been diagnosed with mild sleep apnea and world-class grinder and snore.
The medical word is called bruxism, but it just means that you either clamp or grind your teeth. And that's a sign of some stress while you're sleeping. But you're an athletic guy. You grew up doing sports,
Sure.
and this guy's in shape, you know?
Yep, still do a lot of tuna fishing, a lot of casting for big fish. But I feel like from my grinding, like I have a TMJ issue, and
One side worse than the other?
absolutely, it's the right side.
Okay.
I got a knot here, so I feel that's all related.
And which shoulder do you feel from fishing?
It's my right, but I feel like my whole right side has like always given me issues throughout my life. I don't know if I'm just like a really strong righty and it's just been a little more overdeveloped, but like from my glute up to my back and into this shoulder right now, and then my right T-band's been really giving me some issues.
All right,
so I'm really hoping you could look at that.
Yeah, we'll work on all that today.
Yeah.
We'll do it all. And then how about breathing? Do you breathe through the mouth, or you're a nose breather? No problem with that?
During the day, I'm definitely a nose breather, but I definitely get stuffed up like this time of year. It's real intense. Use allergy medicines, but not habitually. I forget. So it's kind of really excited to see how this will open me up.
Let's try this body oxygen level test. It's called BOLT, B-O-L-T. It's something I do with people that have mild sleep apnea or any breathing issues or breathing dysfunction. And what it really tests is your sensitivity to CO2 levels, because when we pause the breath, our CO2 levels in our bloodstream go up, and that can trigger waking up at night or not getting that deep, deep sleep where you get that rejuvenation of a good night's sleep. You're gonna breathe in gently, breathe out gently, hold the nose, and then see how long it is, okay? Go, yeah. And hold your nose. And we turned on the clock. And so remember, this is not a maximum breath hold. It's just till you feel that first trigger of like, okay, I'm gonna breathe now. And then you let go. Okay.
Push it? Yeah. I didn't know if
No, so he did really good. So under 10 seconds is horrible. That's a severe breathing dysfunction typically. 10 to 20 seconds is good. 25 seconds is excellent.
Yeah.
So that was good.
A little bit,
yeah,
I didn't know if you wanted me to.
He did 28 seconds, so I'm good. I'm not so worried about this guy. Someone with severe sleep apnea will usually get triggered within like 9, 10, 12 seconds in that range. He wants to work on his nighttime breathing. He has the grinding at night, but he's not a mess. And this is a healthy guy, and he's just fine-tuning some of the things that he's aware of. So this is good. Cool. This is good, okay? Let's get cracking. So I want to check range of motion. We know his right side is the one more involved in casting when he fishes. I'll carry the weight of the arm. And here it stops. Do you feel the difference? So when we do this one, it gets a little tight at the top, but it goes all the way up finally, which is good. And this one, I'm doing the same thing. I'm holding the arm down because I don't want the scapula to glide up and him to cheat. But by the time I'm here, it already feels pretty locked. I'm pushing even harder, and now it's totally locked. And I'm using the same technique on both sides where I'm holding the shoulder blade down, and I can pass through that tight spot at the top and complete the task of raising the arm. But in this one, do you agree?
Yeah.
That side's different.
No, totally.
Right?
Yep.
Passive range of motion. because I'm doing the lift for him, so he can just be passive and let me do it. Active range of motion is when the patient lifts their own arm, or the client or the participant. So now you're gonna start with your good side so you can feel what I felt. Start with the good side, and you'll see that it does glide all the way up, and it gets to the top where the bicep just about touches the face, and then come back down. And do it the same way, and you tell me where it feels different.
I'm starting to feel it right now.
Yeah, so
and then
already,
up into here.
and then it kind of locks, right?
Yeah, it's
like how do you get it further without cheating? Cheating would be like, well, I could do something weird.
It's like from here into here.
You see the difference,
Sharpness,
right?
Yeah.
All right, so let's work a little bit. And I wanted you to feel it too, so that we have that reference point. If it's just me doing it, then you might go, well, you know, I don't know, he was like making me do it. That, you know, I wanted you to find it.
Sure.
So we're gonna do a few layers, okay? Layer one is we're gonna move this collarbone and we're gonna lift it. So lift your chest up a little higher. Number two is we're gonna push the scapula, turn this way a little bit, from lateral to medial, or from outside to inside. And there's a specific bone here, or edge of the bone, called the spine of scapula, and it's a ridge of bone here. And I use that as a lever. Then I'm gonna come to the head of the humerus right here, and the humerus meets the, this is where the AC joint is, the acromion, clavicle, and humerus all come together here. So I'm gonna push the humerus down and try to unimpinge it a little bit. Then I'm gonna grab this with this prong and pull his humerus at the distal end and pull that down a little bit. And we still have a lot of work to do, but we're just gonna test at each stage. So that's just an osseous or bone adjustment. We still have a lot of muscle to do, but it's already passing through that first layer. Do you see that?
Completely.
So he was getting stuck here, and then we couldn't go any further. So now we got it to here, which is another 10 or 15 degrees of range of motion effortlessly. The rest is all muscle, so I got to do that, and that doesn't feel good because I'm going to dig in. But you feel that, and see if we got another few inches of lift.
Yeah, completely.
Yeah.
Into here, but
So the first part was the bones being stuck, and then the second part, and here, I'll show you something here. Put your fingertips, this is the head of my collarbone, right? And when I move the arm, do you feel how it rolls?
Yep.
I mean, it clicks a lot because I'm an old guy, but it moves a lot when I move my shoulder, right? Look how much it moves. And you can do this on yourself. If you're watching, put your fingers on the head of the collarbone and move your shoulder around. You feel how much it glides. So this one wasn't gliding, so I first had to free it up. And under his latissimus, the lat, the big muscle of the back, attaches here and it comes all the way down to the bottom of the back. And there's some nasty attachments up under here that lock up when you've injured your shoulder at some point. And I'm gonna come in here, I'm gonna trap his tricep with my head so he doesn't have to hold it up so much. And I'm gonna dig out this horrible spot here. And you feel it doesn't feel great, does it?
yeah, now it's tender in there. Yeah, for sure.
Right in there.
Yep.
Yeah, I found it now. And here, spin around towards her again. So I'm in here, I'm in that armpit. And I'm where the latissimus dorsi, or the lat muscle, attaches. And I'm gonna come into here. And you can see where my fingertips are. You can come all the way through if you want. There you go. Ah, right in there. Ah, good. Now watch this. Come back out in front with the camera and then face her again. Relax the arm a little bit and let's bring it here like we did the first time.
Yeah.
It's getting there now. You try it. And there's more.
Yeah, it just feels like a lightness too in here. Like,
Yeah, so there's a lot of layers left. So next you're gonna lie on your side on this table and we're doing more of the same. But this time I'm gonna really put my body weight into it and I'm gonna start getting into this tendon and this insertion. If you know anybody that has chronic shoulder pain or frozen shoulder, he doesn't have a frozen shoulder, but he has chronic symptoms in his shoulder, save this video, share it over to them, subscribe, help us out with the channel. But I really would love for people to share this information. And he's got a great case of someone that's going to respond well today. So now that's a bad spot, right? Do you feel that one?
Oh, yeah.
That almost hurt.
It does hurt.
Okay, and then this right in there. Oh, wow. And that one. You feel those, right?
Oh, yeah.
He's got a very high tolerance for pain, so he's very stoic, but you can feel this shit, right?
100%.
And then this one, and I'm digging in now. I'm putting all my weight into it. He's much bigger and stronger than me, so I have to use a lot of leverage. And right in there's another one. And then this one. And I'm hitting all these points up and down through here. Okay, good. Now we have the front now. So lie on your back. So first I'm going to do pec minor, and that's the pectoralis minor muscle, which is smaller than the major. It attaches to the front of the shoulder in ribs 3, 4, and 5. But you're going to see you're going to have a different shoulder today. So I'm hoping this alone was worth the drive, but we got more cool stuff to do because we got your jaw, we got your neck, we're just doing your shoulder. We got your IT band on the right, his whole right side really, and then also CFR today.
Giddy up, Doc.
Giddy up. There, that's the spot. Do you feel that one? Oh, right there. All right, so next, big breath in and blow it out. There it goes. Do you feel that crack?
Mm-hmm.
Look at that now.
Yeah.
You try it.
Just feels like ease.
Yeah.
Like ease,
take it all the way up.
The lightness to it.
Yeah.
Like where it was so stuck, like you said.
Now, still needs some healing time, but look at this. That arm is moving. Look at that. I'm barely touching it. I don't have to crank it up. I don't have to use a lot of strength. It's just moving like a shoulder. That's what a shoulder should do. It's actually moving better than the other one in a way.
Definitely.
Isn't that cool?
The other side feels left out.
Yeah. All right, let's do something for the other side. So this one will come over here. This one comes in here. I don't know if this one will crack it. A little bit.
A little bit.
Yeah.
Oh,
That one's
there you
okay.
go.
Yeah, there you go. That's what it was missing. And here's his ear. Little crack there. Did you hear it?
Yep.
All right. So I'm actually going to use the side of my elbow into his face, but in a good way, okay? Open this up just a little bit, and I'm just going to drag his jaw down. So it's more of a stretch. Good, and let's do one more. Good. Actually, I lied. Let's do one more. That's intense, right?
Yeah, it's intense.
But now I'm going to adjust it.
Cool.
This comes in here like this.
Oh.
Got it. That was cool, right?
Yeah, that was big.
So I took the jaw and the neck at the same time.
I've never had a crack like that.
Yeah. And you could hear that crack.
It kept going.
Yeah. And I'm going to have you sit up and tilt your head a little bit to the left. There you go. Tilt a little more. Big breath in. A little more. You got one there. I think that's it for the neck. All right. He was really jacked up on the right. He was really a right-sided guy. So now lie on your back again. Big breath in and blow it out.
Oh my God.
Do you hear a crack?
Oh my God, no, that was like
I heard it go whack.
6 cracks. Oh.
There's more. Good. All right. I think you got some distortion in the rib cage from that side being tight for so many years. So I want to adjust your rib cage next. Does that make sense? So like if you do a one-sided thing, you have everything from here through the face, through the neck, through the shoulder, all the way through.
I didn't feel like this even.
So I'm going to follow that. So I'm going to pull this and then look down at his fingers. Do you see how this one's a little longer right here? So the right side is high. I could see that without showing you, but can you see that yourself? Do you see how this side's a little higher? So what I'm doing is I'm pulling the arms up, I'm pulling them together, and then the right side's high. by like half a centimeter or a centimeter. I'm just trying to visually show you what I see because you can't see that on camera, but what I'm feeling on him is, watch me, his right side's up, and you watch me too. It's up like this because of tension, right? It's all pulling and pulling. So now I want to set this, pushing it down and setting it like that. And I do it a few times. Good. 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 Now watch the difference. It's even now. Do you see that? Because it was pulled up. He described it perfectly. I didn't figure any of this out. He gave me all the information. He said, this is what I feel, and I feel like my whole side, and I feel my leg.
Everything's
Yeah.
like reflecting.
Yeah, so he described it perfectly. So now I'm going to pull this leg down, okay? Good. And now we got to do more. Put this leg up on my shoulder, okay? And then drop it. Like, let it relax. And pull the whole hip down. Whew.
Oh, God.
Okay. Ooh, it just popped a little. Do you feel it?
Really?
Big breath in. Okay, good. Let's go to the other side. All right. Walk around, see how you feel. Stand up, move a little bit. It's good. Remember, it's stuck?
Yeah, it's like,
How do you feel about that?
oh, really good. That's solid.
Yeah, go bring it all the way up again. There. Pretty cool, right? But it's just mechanics. It's just carpentry. It's work. He's definitely has some snoring issues, some nighttime breathing, nighttime jaw grinding. We want to just open his passageway. If you know anybody with sleep apnea or snoring or bruxism, which is the grinding, save this video, share it over to them. Maybe they'd learn something. Maybe this is something that would be good for them. They could look up to see if anybody does it in their area, or they can come to New York and meet me and try it here. Let's get cracking. Your left side first. I'll talk you through it so you don't have to remember anything. Big breath in and close your lips. That was intense, right?
Yeah. Yeah.
Did you feel any cracking or separation?
Yeah. No, I felt cracking.
Tell us what you felt and where you felt it.
I feel like I felt it like up in here.
Yeah.
I wasn't expecting it. Like it kind of surprised me.
Yeah, it's intense, right?
Yeah.
How's your breathing now? Getting some good flow though, right?
Definitely have flat.
Yeah. All right, well, let's do the other side. We're going to do the right side now. Again, this is just to support him on proper breathing and help improve functional breathing for him. So here's the other side. Big breath in and close.
Oh my God.
That was bigger too, wasn't it?
My ear. No, it opened me up.
Here's 2 tissues, okay?
Thank you. That one came like all the way from here, but all the way into my ear and like my TMJ. I felt like I definitely had like a crack here.
Good, because that's your bad side, right?
Yeah,
Your bad jaw.
Definitely was much more into this side.
So typically we'll do the easier side first, and since he had a lot of symptoms, his jaw is tighter on the right, even his shoulder was like, I thought let's leave the right side for last. And it's usually just a good idea to start with the easier side. And the right side was worse,
It went
right?
all the way into my ear. I feel like my ear's still a little kind of not as open as this side right now. So.
Do you want to do 2 more as long as you're
Is
here?
that okay?
Yeah, it's really okay. Well, we always do 2 balloons, but sometimes we do 4, sometimes we do 6. I can also just do 1 extra on the left if that's what it takes. But I'm going to do a little bit higher up into the upper section. Big breath in and close. There it went.
Oh my God.
That was a big difference. So that we got it that time.
Yeah.
You're done for today. That's all you needed.
Yeah.
Okay, so come sit up. That's but we were missing that one. How was that? Did that one get it?
Yeah, 100%. Amazing.
Okay. You're getting some good air now.
Yeah, definitely. Wow.
Good.
Pretty wild, that.
You're a good man. I really
You're a good man.
appreciate
I appreciate
meeting you. Thank you.
being here.
Yeah.